Well, good afternoon, everyone, and thank you to CASA of Santa Cruz County for inviting me to be a part of this important event. And thank you for being here today as we come together to recognize April as Child Abuse Prevention Month. It's a time to reflect, raise awareness, and most importantly, take action. This year's theme, Powered by Hope, Strengthened by Prevention, reminds us that change is not only possible, it's already happening. Hope is what fuels our efforts. Prevention reminds us that when we wrap families in care and support before a crisis happens, we can prevent trauma, build resilience to protect our most vulnerable children. Child abuse is not just a private tragedy, it's a public health crisis, a moral imperative, and a shared responsibility. Every single child deserves a safe, stable, and nurturing home. While the statistics can feel heavy, the truth is simple. Abuse is preventable. And when we invest in families, support communities, and pay attention, we can thrive. Here in Santa Cruz County, we are proud to be part of a community that leads with compassion, collaboration, and a commitment to trauma-informed care. Last year, the County of Santa Cruz Human Services Department's Family and Children's Services Division served 248 children who were abused, neglected, or at risk, working to ensure child safety, family well-being, and permanent stable homes. The county's Children's Network and Child Abuse Prevention Council brings together leaders in public education, government, and nonprofits to support child abuse prevention across the community. Encompass Community Services is the lead agency for the county's Families Together program, a voluntary home-based service designed to strengthen the parent-child relationship and support healthy development before a crisis occurs. Through a strengths-based approach, families identify goals and support positive parenting, child safety, family literacy, and school readiness. And Santa Cruz County also proudly aligns with the Adverse Child Experiences ACEs network. Adverse child experiences, also known as ACEs, are stressful or traumatic events during childhood, and they can have profound, long-lasting impacts on developing brains and bodies. If left unaddressed, these experiences can harm children, families, and communities. The ACEs network care works to spread awareness of the ACEs Aware Initiative, which includes screenings, risk assessments, and referrals to medical, social, and community support systems. I am proud to be taking a lead this year on the budget request to continue that most important ACEs funding in our state budget. So we're not doing this work alone. We are across the state. California is leading with bold, proactive strategies to prevent abuse and uplift families. Through the Office of Child Abuse Prevention, the state funds and supports family resource centers which offer parenting classes, home connections to community resources that help families thrive. I was proud last year to also carry a bill with AB 2496 that was a foster family agency bill. They were losing their insurance, and we got into quick action to address that crisis to ensure that those 10,000 foster family kids were able to remain in their foster family homes and not revert back to the cares of the county. Additionally, the state funds Parents Anonymous, which operates the California Parent and Youth Helpline and online support groups, providing emotional support and referrals in English, Spanish, and other languages. Parents and youth can call or text or chat to find help and connection during challenging times. For new parents, there's the Text for Baby. There's a free mobile app that delivers essential health and safety information, including weekly updates on baby development, medical tips, appointment reminders, and helpful videos, all to support parents in those early stages of raising a child. I wish I had that for my kids with four children. They're 27 and 30 now. And the state's also taken legislative action, passing laws that protect the financial interests of child influencers on social media and increase safety and accountability in youth treatment facilities. Organizations like CASA play a vital role in this work. CASA advocates support children who have experienced abuse or neglect, offering them consistency, compassion, and connection in some of the most difficult times of their lives. They help ensure that every child has a voice and a chance to heal, grow, and thrive right here in our community. I'm deeply grateful to CASA, to every advocate, volunteer, and professional in this space, and to every community member who believes that every child deserves safety, stability, and love. Together, these efforts send a clear message. California values its children, not just in words, but in laws, in services, and in action. So today we invite all of you here in the room to join us. We are wearing blue to show support for the month, share a resource, talk to a neighbor, support a struggling parent, and most of all, listen to our children. Believe them, protect them, and champion them. Child abuse prevention is not just about responding to tragedy, it's about building communities where tragedy never happens. To every advocate, every social worker, every teacher, and every neighbor making a difference, thank you so very much. Together we can ensure every child grows up not only safe, but seen, supported, and surrounded by love. Thank you so much for having me today.
I'm Jim Bonds, I'm the director of the Pregnancy Programs here at Paso Santa Cruz. And I want to say a bit about the families that we've seen in our work here at Paso Santa Cruz, because what I've been struck by seeing the hundreds of families we've worked with is just how much love there is between parents, kids, and vice versa. And we're honored to be able to work with those kids who have experienced abuse and neglect. But what I really hope is that we can, as a community, find ways to prevent those families from coming into port to begin with. I have a 1.5-year-old, so I'm a newish dad. And when I think about what keeps me stable, what keeps me as good parent as I can be, it's the people in my life. It's my friends, family. It's the people that this couch I could crash on if my housing became unstable, or if food, people would give me food if I couldn't eat the food myself. And those are the things that keep a family strong and a community strong. And so that's what I hope for, is that, yes, we will be there during the files are used and needs a consistent person. But I hope that we can spark community, step in, offer help to the family, and that encourage people to ask for help when they do it. And that we can do this work of prevention together, which is a very little team sport, and caress all of home.
Well, good afternoon, everybody. My name is Las Padilla. I am the president of Hasta Santa Cruz County, and I live in the county. I think the leadership message is really important for us here in the community. But I really want to emphasize the theme that we have. And this is a theme that came to me when I read it. Powered by hope, esperanza, hope, and strengthened by prevention. I think we are living uncertain times right now. Even though our advocates and our community, especially in Santa Cruz County, we're a very tight community. We all work together, but we're all going through an uncertainty as we largely plus new administration. But I'm hopeful, tengo esperanza de que las cosas se van a poner mejor. Things are going to get better. But that we need to continue working as a team, working at a level as advocates with families, making sure that our board of directors works with the community that we're serving, making sure we're collaborating with our executive directors, making sure we're incorporating our city councils, our city officials, making sure we go into the state, the county, and obviously, assemblymen and our leaders up there in California. So again, I am truly grateful for all the advocates. I think FASA has a really important tool, and that's getting a mentor to these children and to these families. Without these advocates, I don't know really what FASA would do, because there's these advocates that have life experience that are really engaging these women and these young adults and these children and the families to engage in those prevention services. Because when somebody is healthy, not just in a mental perspective, but in a human perspective, in a health perspective, that they're going to think better and they're going to be wiser, make better choices, and that's what we need, prevention. So let's continue with our message this entire year. Let's continue power by hope, and let's make sure that we strengthen the preventions. So thank you for everything. Thank you on behalf of board members, we are 100% with the advocates, with the staff, with Lynn, because we're going to continue fighting this month of child abuse movement. I think it complete.
Good afternoon, everyone. My name is Susan Maroon, and I have been a CASA advocate for the last 3 years. I'm also a social worker in training that works as a therapist with transitional age youth and adults. I'm here to talk to you about a critical issue that affects the very foundation of our society, the well-being of our children. Child abuse and neglect are devastating problems with long-lasting consequences, but I stand before you with a message of hope and empowerment. We know that by focusing on what children need to thrive, we can dramatically reduce the risk of harm and set them on a path towards resilience and success. These essential elements are what we call protective factors. They are the strengths and resources within families and communities that buffer children from adversity. Please allow me to highlight 5 key protective factors. Parental resilience. This is about a parent's ability to manage stress, solve problems, and bounce back from challenges. When parents are resilient, they are better equipped to provide consistent, nurturing care even in difficult circumstances. We can foster parental resilience by offering stress management training, support groups, and access to mental health services. Social connections. Strong relationships with family, friends, and community members provide a safety net for both parents and children. These connections offer emotional support, reduce isolation, and provide access to resources. We can strengthen social connections by supporting community organizations, creating parent support groups, and promoting positive social interactions. Knowledge of parenting and child development. Understanding children's developmental needs help parents to provide appropriate care and guidance. When parents know what to expect from their children at different ages, they are less likely to become frustrated or resort to harsh discipline. We can promote this knowledge through parenting classes, home visiting programs, and accessible information about child development. Number 4, on-street support in times of need. Access to basic necessities such as food, housing, and healthcare are essential for family well-being. When families have their basic needs met, they are less stressed and better able to care for their children. We can provide this support through programs like food assistance, housing subsidies, and access to affordable healthcare. 5, children's social and emotional competence. Children who are able to regulate their emotions, communicate effectively, and build positive relationships are better equipped to cope with challenges. We can foster this competence through early childhood education, social skills training, and by creating a safe and supportive environment for children to learn and grow. When these protective factors are in place, children are less likely to experience abuse and neglect. But the benefits extend far beyond prevention. These factors also help children develop the resilience they need to overcome adversity and thrive. Resilient children are more likely to succeed in school, have positive relationships, avoid risky behaviors, and become healthy, productive adults. Investing in protective factors is not just a moral imperative, it is also a smart investment. By strengthening families and communities, we reduce the long-term costs associated with child maltreatment, such as healthcare expenses, criminal justice involvement, and lost productivity. I urge all of you, parents, educators, community leaders, policymakers, to join us in this effort. Let's work together to build a society where every child has the opportunity to thrive, free from the shadow of abuse and neglect. By focusing on protective factors, we can create a brighter future for our children and a stronger, more vibrant future for us all. Thank you so much.